Hi everyone, my name is Andani. I'm a medical student at the University of Colorado School of Medicine. I'm joined today by Sarah Groover, also a medical student at the University of Colorado, and Emily Heideman, a medical student at Morsani College of Medicine. Today we wanted to talk to you about a project that we've been working on with collaboration with the ACLU called the Know Your Rights car sticker. So a bit of background, law enforcement's use of excessive force is a matter of public health. The most common reason for contact with the police is being a driver in a traffic stop. And in 2012, an estimated 1 in 291 police stops or arrests resulted in hospital-treated injury or death of a suspect or bystander. Our aim with this project was to increase transparency about local and federal laws regarding traffic stops, as well as the citizens' rights in vehicle-related police encounters. Our big picture goal was to inform and empower citizens of their rights and suggested best practices during a traffic stop to reduce violence. The question then becomes, why are a bunch of medical students interested in informing citizens of their rights? The answer is that it's a matter of public health and inherently a matter of medicine. The question we wanted to answer is, how can we increase transparency about local traffic laws while incorporating the interests of multiple stakeholders? Those stakeholders including the ACLU, the Colorado School of Public Health, the Aurora Police Department, the Injury and Violence Prevention Center at the Colorado School of Public Health, and most importantly, the citizens and community of Aurora. Our idea then was a Know Your Rights car sticker. What we aim to achieve is a tool that is non-invasive, follows local laws, easily readable, and translatable. Essentially, we were trying to mimic an oil change sticker in the top left corner of the driver's windshield, something that's non-invasive and easily readable, but also serves as a reminder of rights during a police encounter. We followed a quality initiative format where we created a sticker, moved on to testing, go to printing, and then finally distribute. We'll talk more about the printing and distribution in subsequent slides.
So here's what we've done so far. So we've received a grant from the University of Colorado Injury and Violence Prevention Program, which is a division of the School of Public Health. We have developed the prototype for the sticker. And we also created a website. So this website has additional information that we can hold on the sticker that you can access either using this URL or the QR code on the sticker itself. We have applied for IRB, or we have submitted our IRB application and received exemption status. And then we've had multiple meetings with the ACLU of Colorado as well as the Aurora Police Department. So this is an example of a few of our design iterations. So you can see that we've played with the idea of color. We've looked or we've tried to make things easy to read by including like delineation designs. We've included examples of what you can even say in certain situations. We've played with the idea of having icons or not having icons. And then we've also tried to include any relevant information that we needed to, but without making it too busy. And so on this next slide, you can see what our current iteration is. And so you can see that we've kept it black and white to make it most accessible to everyone, make it easy to read. We've kept the alternating gray-white to make it delineated each line. We've included the symbols and we've included examples of what to say. So you can see this QR code that links to the website. I welcome you to scan that. And this has also been reviewed by the ACLU legal team to make sure that we're following all the rules.
And now we'll talk a little bit about our future directions, which is to get the input of members of the Aurora community. And we want to hold focus groups at community centers and colleges. Before handing out the sticker, get a general idea of the comfort level and knowledge of the community members through a pre-test, and then distribute the sticker and have a post-test discussion to see what they learned from the sticker and their thoughts, and then have the participants use it for a month and have another follow-up to see how it's going. All participants would get compensated with a $10 Amazon or a gas gift card. And after that, after we incorporate the feedback from members of the community, we want to get the sticker into the people who need it most. And that's, again, with partnering with the ACLU and using data from the Stanford Policing Project to determine where traffic stops are happening the most and target that those areas for places to hand the sticker out. And throughout all of this, we'll be encouraging feedback through the QR code and website to continue changing and making the sticker as accessible and best possible. And here are our references. And a huge thank you to everyone who has helped us, the ACLU of Colorado, the Aurora Police Department, Colorado School of Public Health, and specifically the Injury and Violence Prevention Center at the School of Public Health. Special thanks to Dr. Ashley Brooks-Russell, Sarah Brandspiegel, Dr. Claudia Parvanta, and Dr. Murray Scott, who is our advisor, and Anna Adin and Pablo de la Rosa Santiago at the ACLU.